Madam Speaker, thank you, and let me thank my colleague from California for yielding. And I rise today in opposition to this bill, frankly, because of my strong support for the SCHIP program. In 1997, Republicans here in Congress worked with our Democrat colleagues to create the state children's health insurance program. I was there, and many of you were here as well. And throughout that process, it was bipartisan, it was fair and open discussion and open debate. And unfortunately today, the voices of millions of Americans who want to provide input into this proposal have been silent in the process. Earlier this week, I wrote to Speaker Pelosi and President-elect Obama expressing our willingness to work together on this critical issue. We outlined our principles for this program's reauthorization. The principles are nothing new. In fact, they're the same principles that led to the creation of SCHIP in 1997. And they're this. This program ought to cover poor children first. Unfortunately, in many states, more than two-thirds of those enrolled in the SCHIP program are adults. And there's nothing in this bill that really does ensure that poor children will be brought into the program first. Secondly, taxpayer funds for this program should not be used to fund benefits for illegal immigrants. And there's been this big debate about whether it does or it doesn't. But the fact is that while the bill says we will not cover illegal immigrants in this bill, the whole verification process that should be in here to ensure that only American citizens and legal residents are entitled to these benefits, the whole verification, no verification system to speak of, is contained in the bill. And we also believe that SCHIP should not force children with private insurance into a state health insurance program. Last year in this proposal, there was language that made it clear that children with private health insurance program, they should stay in that private program and not be pushed into the state-run program. Unfortunately, the bill before us does not reflect these principles, the same ones that have guided this program since its creation. I believe that the bill before us would undermine the original intent of the SCHIP program by expanding the program to adults, illegal immigrants, and upper-income families who already have access to private health insurance. I think taxpayers deserve better, and more importantly, our nation's children deserve better. That's why today Republicans will offer a better way. I said on the opening day when I gave the gavel to Ms. Pelosi that Republicans would not just be the party of no, that we would come to this floor with better solutions. And the better solution that we will offer here soon is a program that would reauthorize SCHIP for 7 years, not the 4.5 years that we see in the majority's bill. It will reflect our principles and make it clear that poor children should be covered first. And it will fully fund the SCHIP program without raising taxes on American families across our country. Madam Speaker, federal funds targeted for low-income children should benefit low-income children, period. Only one measure on the floor today will serve those children's interest, and that's what the motion to recommit will contain. So I would urge my colleagues to vote yes on the motion to commit and no on the underlying bill, and I yield back.